the other day about how, as a doctor, you frequently have to pay attention to the fact that what you say is not always what people hear.
That's true.
And so you always want to find out what it is that they heard and make sure that when they leave that visit, they feel like they were heard and that they heard what it is that you had to tell them. Both things are very, very important. At a meeting the other night with several other doctors were there, and it was interesting just hearing everybody's different ways of trying to make things understandable to patients. And everybody had different ways of doing it, but it seemed to work well for them. And I think that's the important thing, is getting things so that you can communicate and make sure that that information gets across. So one of the other things I think that is very important is anybody who's told by their doctors, and this happens, I would say probably at least 80% of the people that go into a doctor's office, but when they get told to go start to do some exercise. And usually that's walking, and more than just to the kitchen and back. And so what happens is that they don't check, they tell them, okay, well, you have to check with your doctor before starting any exercise program. But all they do is they check with their primary doctor. And many times we'll see people 1 month after they start their walking program in the podiatrist's office because nobody ever looked at their feet, looked at their shoes, talked to them about stretching exercises. And you go out and you're all gung-ho and you still think you can, because we all still think we're 20 years old inside. And so we go and try to walk like we did when we were 20 years old, and something happens, and you end up with pain in the arches or in the heels or in the legs. And so one of the other things that I think is important is to make sure if your doctor tells you to go for a walking program, tell them, hey, I want to go see the podiatrist and have my legs and my feet checked out before I start to do that, so I don't end up in there with a problem later on. So I think that's one of the other things that, it's so funny, I told you, I wasn't sure whether I'd be able to think of enough things to say, and now every time we come up with something, there's a new topic that I thought about that I hadn't even said I was going to say anything
You talk about it. Let
So I
people
think
know.
that's very important, and I think just important little small things like we talked about, when you buy new shoes, to buy them at the end of the day. Because at the end of the day, your feet are a little tired, you might be a little sore, might be a little swollen. And if you buy them first thing in the Saturday morning, by the time you get home on Saturday night, you go, why did I buy these shoes? So that's
true.
one other important little thing. And the importance of good socks. I think that gets downplayed too. Everybody thinks that socks don't matter. And we used to think that all cotton socks were what all diabetics had to wear, and that if they didn't, now we've changed that. And a lot of people still want to wear cotton socks, and cotton socks are actually more likely to cause blisters than cotton poly blend socks or wool blend socks or those kinds of socks.
I didn't know that.
We didn't talk about that, Jim. And I think that other things that are important in terms of when you go to examine your feet at the end of a day. Let's say you can't, either you have a back problem or you've got a problem with, just your tummy gets in the way or something and you can't look at the bottom of your feet. Using a mirror to look at the bottom of your foot is another thing, especially for diabetic patients. That's very, very useful. And just put it down on the floor and look down there and see the bottom of the foot and look for any signs of any problems. Or have a family member look at them if that's something that...
She did my feet. She did my feet the other night, boy. She is serious.
Really? Oh, wonderful.
Yeah.
That's fantastic.
Yeah.
That's, I think, massaging, if you can get anybody in your family to do that,
do
put
it.
cream on and massaging.
Yeah.
Very, very good. It increases the circulation. Also, then that person will find things that are different, that wasn't there before, and they will be able to tell you, hey, I think that you're starting to develop a blister or a problem, and that it needs to be addressed right away. Because all big problems start as little problems. Whenever I see a wound patient, a person who has a sore on their foot, there's always people say, oh, well, I've always healed before. And that's always true until you don't.
Yeah.
And that's when, all of those little things like the circulation problem or the lack of sensation or that bump on that toe that, gets pressure on the shoes, those all come into play when that wound forms that sometimes will keep it from being able to heal well. And so catching things early and not being in denial of a problem
Right.
is so important with feet. I would say, you know,
That's all your body's on your feet when you're up walking.
yep,
All your weight is
all
on
your
your
weight
feet.
is on there.
So you have to be very, very careful
Yeah.
about your feet.
I'm glad that you realize that because it is so it's so true and so important.
I've been soaking my feet in Epsom salt water for a while. And then I put a little
And you put the
peroxide.
cream on afterwards?
Mm-hmm.
Okay, good.
Peroxide.
Now, what are you doing the peroxide for?
Just to clean. Make sure they're clean.
So, peroxide has some pluses and minuses, so that gives us an opportunity to talk about that. So, peroxide is a really good thing to use if you have like a dirty cut, like you fell down and you scraped up your knee and there's a lot of dirt in there.
Mm-hmm.
And it's okay on closed skin because then that skin is not going to be irritated at all. If you've got a sore though that's trying to heal, peroxide will slow down the healing. All those nice
Oh,
bubbles
yeah.
that we see,
Oh,
those are sometimes killing off the new cells rather than killing off bacteria.
I didn't know that.
So you always want to be careful about when you use peroxide. And then also the other thing about soaking is to remember not to soak for too long.
Mm-hmm.
So, and to make sure that you put Epsom salts or table salt or something like that in the water because our bodies have a lot of salt in them. And so if you soak in plain water that doesn't have any salt in it, then what it'll do is it'll pull the salt out of your body.
Mm. No, see?
See, even just as many times as we've talked, and I still haven't, there's still new things.
You're
So,
learning. You're learning.
so
You're going to do it again.
and soaking for more than like 15 minutes is not such a great idea because what happens is it pulls too much moisture into the skin, and then the skin isn't as strong.
Yeah.
So, because some people like to sit in there for half an hour, it's a bit longer than you should.
Okay. Okay, 5 or 10 minutes.
5 or 10 minutes, 15 at the most.
Mm-hmm.
And then making sure always to dry really well between the toes, because that's one of the biggest places that infections start is between the toes.
I use a lot of Vaseline after I drive.
After you
I use
dry
a
off.
lot of Vaseline.
Just not between the toes.
Everywhere.
Everywhere?
Mm-hmm.
Well, don't put too much between the toes,
No?
because it'll block the air from getting in between the toes,
Mm-hmm.
and that will sometimes allow, and since it's a dark, damp place, it's a
My
place
feet
that,
itch a lot. You get dry and itch a lot.
that's because your circulation isn't as good as it should be.
Mm.
Yeah. So what happens when your circulation isn't as good is sometimes you'll get some pooling of the blood and it won't push back out. And when that happens, then some of the blood cells will come out of circulation,
Mm-hmm.
and then your skin actually develops an allergy to that.
Mm.
And so elevating your legs is a very good idea because
Okay.
that helps to prevent that from happening.
Okay.
And then also making sure that you do put cream and lotions on your skin, 'cause especially in wintertime, our skin gets very dry. And then that will tend to make it real itchy. And
Well, this show has been nice.
it has. It's been very
It
nice.
has been nice. It has been very nice.
So we have 5 more minutes? Oh, good.
Yeah.
So what do you want to talk about now?
Oh, whatever.
Okay.
Talk.
So let's talk about one of the things I think that people forget about is that their feet are sort of the foundation of the rest of their body.
Oh, yeah.
And I think that a lot of times, getting achy legs or achy backs or those kinds of things can be related to wearing improper shoes or wearing shoes that don't support their feet properly so that they aren't lining up their feet well with their legs and their back. And also not working on stretching well enough is another thing that can do that. But anytime that somebody has issues with knees, hips, feet, back, it's always important to look at what their shoes look like, how their foot's sitting on the ground. And if somebody is sitting up in a chair and they've got a bit of an arch and they stand up and that arch collapses completely, that's actually a lot worse than somebody who's got a flat foot sitting still and a flat foot standing up.
Mm.
Because that means that the rest of their body had to compensate for that,
Mm-hmm.
and then that puts a lot of stress on your lower back.
Mm-hmm.
And so that's another thing that ends up being something that you can see a podiatrist for that you never ever would have thought about. And Dr. Towner, the other doctor that works with Dr. Millen and I, she's started to be a big advocate for that, I think, because she started to realize that that's true in a lot of her patients, that not wearing good shoes, and that's ending up creating some problems with their back.